Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to today's Wednesday news conference for the latest in COVID-19 information for the Amarillo community. Once again, we do these every Wednesday at 11 a.m. Let me go ahead and briefly announce who's on our panel today. We are joined by Amarillo Mayor Ginger Nelson, Casie Stoughton, Public Health Director for the City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center, Dr. Brian Weis, Chief Medical Officer for Northwest Texas, Dr. Michael Lamanteer, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We will open it up to our panelists to make some statements, and then we will take questions from our meeting. Let's go ahead and start with Amarillo Mayor Ginger Nelson. Mayor, how are you this morning?
I'm well, Dave. Thank you. Good morning, Amarillo, and happy Thanksgiving. As we gather this week and think about family and think about traditions, maybe we're getting to follow some of our traditional Thanksgiving week activities, but maybe you've changed yours. And if so, I want to say thank you for the changes that you're willing to make to keep our community safe. As we gather this week, I want to tell you a story. Last week, my husband had some very mild symptoms, just a little bit of ache in his neck and maybe a slight headache. And he said to me, you know what, I'm going to go get tested. And I said, well, that's okay. That's probably wise. So he used the public health drive-through testing site. It was very convenient and he was very pleased with how that all went. And we were all very surprised when his test came back positive. So sure enough, a couple of days later, I start having some very mild symptoms and I go to get a test and my test is negative. And then after a couple more days, my symptoms get more intense. I go for another test and it's positive. So why do I tell you all that story? It's because as we are coming up on Thanksgiving and maybe tomorrow you're considering being with your extended family, I want you to know that it can be surprising that you have coronavirus. Your symptoms can be very mild. It maybe you're one of those diligent people who went and got a negative test just so that you can feel good about being around your grandparents. And I want to let you know that a negative test doesn't always mean you're negative. So that's why I tell that story, is just to help all of us remember that this is a strange virus. And in this season that we are in of gathering as families, traditionally, I want us to be extra cautious about being around our family members who might be compromised or being around our family members who might be older. You might think you're fine, but the last thing I know that any of us would want to do is to put them in a position where they would get this virus and not be able to recover. So the Nelson family is quarantined for Thanksgiving, and we are resting and treating our symptoms and seem to be doing just fine. But there's a lot for us to be thankful for this week. And I am thankful for our city staff. Our communications department has held the burden of putting these press conferences together. They've done dozens. Sometimes early on, we were doing them 3 a week. We've been doing them at least once a week since March. And I'm really grateful for all the work that the communications staff has done. I'm grateful for the leadership of our city manager and for the diligence of our public health department under the leadership of Casie Stoughton. I'm thankful for these doctors that are on this call, as well as every doctor and nurse and medical worker who's on the front lines keeping our city as safe as they possibly can. I'm really grateful for our nation and for the many, many freedoms that we have. But most of all, I think I'm grateful for you, Amarillo. I'm grateful for the Texas Panhandle. What a great place we live. And we've been doing hard things together, but I think we're doing them as well as we can. And I'm really grateful for all of the encouragement and all of the grace that we're giving and showing each other. So I just want to speak a blessing over you and your family. And I hope you have a wonderful, safe, and happy Thanksgiving. Thank you, Dave.
Thank you, Mayor. You and your family are in our prayers, definitely.
Thank you.
Let's go to Casie Stoughton, Public Health Director for the City of Amarillo. Casie, good morning.
Good morning, Dave, and thank you, Mayor. As of yesterday, there were a total of 22,077 cases of COVID-19 reported in Potter and Randall counties, 12,047 cases in Potter County, and 10,030 cases in Randall County. We have a total of 14,718 recoveries, and on this Thanksgiving, we're thankful for each and every recovery. We have 277 deaths reported in Potter and Randall counties, and we're heartbroken at each and every death. That leaves us with 7,082 active cases. Each of the cases do represent a unique and a special individual. The total 7-day rolling positivity average for Potter and Randall counties is at 21%, and the positivity rate at the drive-through testing site is at 45%. The 5-day new positive case average is at 485 new cases per day. The public health drive-through testing site remains operational. Individuals can call 378-6300 to be screened and directed to the test site. The drive-through testing site will be open today until 3:00 p.m. and then it will be closed Thursday through Sunday because the lab is closed. We will reopen the drive-through testing site on Monday. Our community remains at level red. Conditions remain consistent with level red as all indicators are over the threshold for level red. This morning, we reissued another status level red. It will be in effect for the next 2 weeks, and we will continue to evaluate those established indicators. GA32's hospitalization rate for the 25 county Panhandle RAC region has been over 15% for over a month now. Yesterday, the RAC's hospitalization percentage was 39.35%, meaning that just over 39% of all hospitalized patients have COVID-19. Dr. Weis and Dr. Lamanteer will provide a briefing on hospital status, as well as Dr. Gonzalez. He'll give us a briefing on the status there at the VA. However, it is important to note that our current hospitalization rate for local Amarillo, Potter, Randall counties is at 4.3%, meaning that 4.3% of all active cases are requiring hospitalization. The slight fluctuation in hospitalization rate can be seen with an influx of cases, which we do see daily. Tomorrow is Thanksgiving, a time when we remember all that we're thankful for. This has certainly been a difficult year and continues to be hard for everyone in our community. Please remember all the COVID prevention steps that we've talked about since March, making wise decisions by not gathering in groups. I speak for the staff at Public Health in wishing you a safe and happy Thanksgiving.
Thank you, Casie. Let's now go to Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center. Dr. Milton, how are you today?
I'm fine. Thank you, Dave. The numbers remain very concerning. I think it's clear to see that that's the case, and I'm sure that Dr. Weis and Dr. Lamanteer will give us more insight in terms of the hospitals. I just want to reiterate the point that we need to practice social distancing and especially wearing masks throughout Thanksgiving. As we've alluded to here, it's the time where people typically gather together. There's been numerous and multiple times that we've documented people when they sit down in a break room in the hospital or sit down and eat together and take off their masks, they expose them, all the members at the table. And so I just want people to be very, very careful about that. I was looking at the weather for tomorrow. It looks like tomorrow's actually going to be the warmest day of the week with a high of in the low 60s. And I would even encourage people to try to schedule their meal gathering at the warmest time of the day and spend it outdoors, because we know that outdoor spread is much less likely than indoors. And I would encourage, using video and FaceTime to try to speak to your loved ones in other areas. But for the most part, we just need to try to avoid congregating this holiday period. It's certainly going to be a holiday like no other. On the treatment front, as we may have heard in the news, there are new treatment modalities that are going to be coming on the market sooner than later. And I think that when we look at the new forms of treatment, what we're trying to do at this point is prevent people from getting sick and prevent people from having to be hospitalized. And so one class of drug is called the monoclonal antibodies, and these have been made available now. And we have been receiving that drug or those drugs in Amarillo, and we're in the process of trying to set up how most efficiently to distribute those individuals who would be a potential candidate for that. And what we're trying to do there is try to screen individuals who would be at risk of getting hospitalized and giving them the drug and preventing that. Vaccines will also going to be likely becoming available in the next few weeks. And once again, we'll be planning how to best distribute that. I think it's safe to say that initially we won't get much vaccine, and we will be targeting that vaccine for those that need it the most, such as frontline healthcare workers and immunocompromised individuals, or those most vulnerable, like elderly people. Those plans will be worked out over the next few weeks as we start receiving the vaccine. Otherwise, I would just like to ask everyone to please stay safe, and certainly we will keep everyone in our prayers and our family, and let's have a good Thanksgiving, and let's come back and finish up the year strong. And that's all I have, David. Thank you.
Thank you, Dr. Milton. Let's now go to Dr. Brian Weis, Chief Medical Officer for Northwest Texas Hospital. Dr. Weis, how are you today?
Hey, good morning, David. David, I'm appreciative. I'm appreciative of Mayor Nelson and the council and the ordinance that they passed earlier this week. I cannot imagine how difficult that decision is. And obviously there's lots of concerns about our businesses, but I support that ordinance. I think it's critical for us to be able to reel this virus in our community. It was interesting. I was listening to a lot of the public kind of testimony and concerns on that press conference on Monday. And it reminded me very much of when they were trying to ban smoking from bars in Dallas. And it was the same concerns. The bar owners were saying this is going to affect our business. People would say we're not going to be able to we're not going to go back to the bars anymore. When they finally passed that ban, they saw the exact opposite effect. The bars prospered. What you saw is lots of people going back to the bars who had otherwise avoided them because of their concerns over secondhand smoke. I think the same thing's going to happen in Amarillo here with this ordinance and this virus. I think lots of people have been fearful of going to our local retailers and to our local restaurants because of the fear of catching this virus. And as our businesses and merchants reinforce their safety practices, I encourage people to start going back out to our local businesses to support them, knowing that you're going to be safe now with this ordinance. So I think it was a bold move in the right direction. I completely support it. And I think now it's time for us as Amarillo citizens to support our merchants and our businesses now that we know it is safe to go back into them with these ordinances and the safety measures. Yeah, as Dr. Milton mentioned, we've got a lot of new tricks up our sleeve coming down the pike here. So the immunizations, some of these new meds, I can tell you that both hospitals are scurrying right now, trying to figure out how to best make these things available to the right people in our community. Yes, this monoclonal antibody that's come out, it's not meant for everybody. We know it's meant for people at high risk to be hospitalized and to become very sick. And those are the folks that we really want to make sure we can make it available to and treat properly. And then these immunizations, right now, it looks like Pfizer may be the first one out of the chute. That's the one that needs to be stored at minus 70 degrees Celsius. Just reminds you, the reason is the Pfizer and the Moderna vaccines are made using RNA, which is the kind of genetic material. And the environment is full of proteins that like to destroy RNA. And the only way to protect this vaccine from those proteins is to store it at minus 70, where those proteins cannot work. So that's the reason they have to be stored at such cold temperatures. but it does create a pretty significant logistical challenge for us as to how are we going to be able to get this vaccine to people, knowing that it must be at that temperature until it's delivered to individuals. So these are some of the challenges that I know myself, Dr. Lamanteer, Dr. Gonzalez, and the hospitals are trying to deal with as we work with these new tools. Now, in terms of the numbers at Northwest, today we have 112 positives. We have been consistently somewhere between 110 and about 125 over the last 2 weeks. We have 44 individuals with COVID in our ICU, and 23 of them are on ventilators right now. And that is about 2/3 of our ventilator use right now is for patients suffering from COVID-19. We do continue to have daily holds in our ED for critical care patients waiting for beds. But my bigger concern is we're hearing about the number of patients in the regional facilities, particularly those requiring critical care. They're right now are waiting to be transferred into a higher level of care. This is concerning because a lot of these regional hospitals just were never built for critical care capacity. And this is a concern as we try to bring these patients to a higher level of care appropriately. I think that the big thing is we have had 53 deaths since the beginning of November at Northwest Texas. Every one of these is a tragedy. To put that in perspective, though, we had 20 in October. So we went from 20 in October to 53 in November. This is the scary part. This is the rapid rise in cases and critically ill patients that we keep talking about. And we've got to turn this curve. We've got to lower this curve because this is tragic that we've lost so many people just in the month of November. Our outpatient testing, we did 270 tests yesterday. Out of those, 59 were positive, giving a 22% positivity rate. That has been our positivity rate consistently now for several weeks, is 20+%. Remind you, back in the midsummer, we were down to single digits. So I think until we see that positivity rate decrease, we're going to continue to see the hospitalizations we're seeing right now, and unfortunately, the death rate we're seeing right now. So all the more reason why we've got to focus our efforts. Right now, we have 127 staff members quarantined, but with the hope of having 50 return to work by this coming Monday. So that's huge, but we are still completely dependent on the RAC nursing and even some of the RAC doctors to help us. And right now, our supply of remdesivir, which is the inpatient medicine we're giving, has been more than adequate. We have treated 463 patients right now. We currently have 27 on the drug. Just in closing, I too want to thank our staff at Northwest who have done an unbelievable job for 9 months now fighting this pandemic. And in a spirit of Thanksgiving, these guys deserve all the credit, from our ED docs and nurses to our inpatient docs and nurses. So please keep them in your thoughts as we move into this holiday. Thank you very much.
Thank you, Dr. Weis. Let's now go to Dr. Michael Lamanteer, Chief Medical Officer at BSA. Dr. Lamanteer, how are you?
Good, David. Good afternoon, or good late morning, I should say, everybody, and happy Thanksgiving. This is a time of year that is always a very happy one for me. I love Thanksgiving. I love the fall season. I love getting together with family and friends and being able to share, that communal time to really reflect on what's important. Unfortunately, we're all going to have some difficulty this year with doing that in the traditional way. But I think we all understand the importance of why it's critical that we do this with some alternative means this year, as Dr. Milton has outlined, and as I think we've stressed over the past couple of weeks. And that is, there are ways to share time and spend time with family through video chatting and through talking with folks and other ways, conference calls, things like that, to express your love for your family and your friends. We've got to be smart about this holiday. We are on the brink of a potential situation that is going to put our citizens in the Panhandle here in Amarillo, where we're going to be really stretching the healthcare resources so thin that we're not going to be providing optimal care. What I mean by that is the number of patients that we have hospitalized now, as conveyed by our hospitalization rate, is the highest we've seen. It's also the highest in the state of Texas. Pause and think about that for a minute. And when I was reviewing the stats yesterday in terms of cases per 1,000 that comes out of our state website, we have now surpassed El Paso in terms of cases per 1,000 persons. We've also surpassed El Paso in the rate of rise in those cases per 1,000 over the past 7 days. That's very concerning. We're now in the mid 90s in terms of cases per 1,000 persons. Again, we have counties that are close to us that I found one county higher than that when I was looking through most of the counties in the western part of Texas, and that was Hale County, which is in the 1 teens per 1,000, as you know, which is just north of Lubbock. So we really need to be careful. We really need to be smart. We really need to be considerate in terms of what we're doing when we're out of the confines of our immediate family unit and we're out exposed to others in the public, so we do not transmit disease to others, and we also hopefully don't acquire the infection. I can tell you we had a little bit of a lull in our extremely high census, we thought Monday, when we were at 164 hospitalized patients. 164, and you heard Dr. Weis say at Northwest they have about 120 or so. But that little lull went away immediately yesterday when we were back up to 197. And our peak was just over 200 last week. And that's because the number of patients that we've discharged with COVID-19 was quickly replaced by a significantly higher number of those that needed to come back into the hospital or that were newly being admitted to the hospital. And we're seeing both of those scenarios. We're seeing folks that are coming in and being treated and being discharged. We're seeing folks that come in and that are being discharged and appear to be doing well, but then bounce back in a week or two with more significant evidence of disease, worsening oxygen levels, increased respiratory distress, sometimes blood clotting. We're seeing that as a common complication of COVID-19. People are coming in with blood clots in their lungs and blood clots in other places that are leading to significant morbidity. So again, this is something that we are trying to deal with in the setting of other comorbidities that some of our patients have that are getting admitted. We're also seeing a higher number of deaths in the month of November, just like Dr. Weis mentioned at Northwest Texas Hospital. The percentage of mortalities, I think, across the board for us has been consistent since the outset, but because of the higher numbers of cases, the absolute number of mortalities is obviously higher. So again, the more we're seeing folks come in, the more we're concerned about how we're going to handle that type of severity of illness and what it leads to for potential complications. Today, we are at 186 patients hospitalized with COVID. Of those patients, we have an extremely high number that are in our ICU, approximately 85 patients. And of those 85 patients, 48 of them with COVID are on the ventilator. We have additional patients on the ventilator up toward 60, and again, up toward 53 total. And only because we had additional ventilators come in from the rack this week, 10 more vents arrived this week. Our vent utilization now is right around 76%. That was in the high 80s, close to 90% before the rack vents came in this week, which was a godsend. But as you know, when we get that equipment that comes in, if we don't have staffing, it's only part of the puzzle. So the rack nursing support has been substantial. As of yesterday, we had 153 rack nurses here. Think about that, 153 nurses that are not part of our normal staff that have been necessary to help us manage this patient population. That's a split between intensive care nurses and medical surgical nurses. We had 35 respiratory therapists from the rack here to support our BSA employee respiratory therapy team, who's been working nonstop to manage patients with this pandemic. And we also have several physicians we've been receiving from the rack to help our hospitalist group, who has been working nonstop to manage these patients along with our intensive care physicians. So if you were to ask me as well what I'm thankful for, I'm extremely thankful, number one, for our staff who have been dedicated and committed to providing outstanding care for our patients for 9 months. They've been making sacrifices to provide the best care to our patients. I think that you've witnessed, some of you, hopefully, some of the advertising we were doing across the city with our healthcare leaders regarding masking And those were heartfelt messages that were being delivered to all of you about why we are concerned when folks are not trying to do their best to keep people safe and wear a mask, which is not a big lift. It's not a big ask, but it does have a big impact. That small request has a potential huge impact in terms of preventing the spread of disease and keeping our friends and our family in this community safe. So I have noticed absolutely an uptick in what we're doing in the community with masking, and I'm highly appreciative. Thank you very much for doing that. And I realize that it's been easy at times hearing this for 9 months to get complacent, but we cannot get complacent. We must be diligent in terms of continuing to be safe. So thankful for our staff, thankful for our nurses, our physicians, our respiratory folks, everyone who takes care of our patients here, our environmental services folks, everyone that is a healthcare provider on the front line for both hospitals. We are extremely grateful. We do have a lot of exciting things coming our way. I think the vaccine is the most exciting. I think the monoclonal antibodies are interesting. We may get some benefit there, but I think the biggest impact is going to be the vaccines. We're going to offer that to our frontline healthcare workers first, and hopefully within the month of December, we're going to start getting that rolled out. Dr. Milton and the Public Health Department team is helping us with that, as well as our city leadership. And we're going to work together, both hospitals, to see how we can support one another in terms of making sure the vaccine's rolled out. Again, I think if you ask me where we are today and what our fears are over the next 30 or 60 days, our fears are that we continue on this exponential rise of hospitalizations, and we are not at a point that we can handle this volume. Again, we should not be lulled into a false sense of security because we don't have structures outside the hospital physically, like tents and the like, to manage patients. We are taking care of people in our hospitals in places that were not designed to be intensive care units. And the problem with that is it's never as good as what the true intensive care unit is meant to be. And we're very grateful for Dr. Gonzalez and his partners at the VA for helping us with being willing to take some patients and transfer. If we're asking you to transfer to the VA for your care, it's not because we don't want you at BSA, it's because we can't handle you at BSA. And our partners in the community are saying they can. So please help us when those requests come by to accept those types of transfers. You can see where our numbers are. Even Dr. Weis has spoken to me and said, how can we help BSA? And we're going to be talking more about that if our numbers go up higher. So again, I'm going to finish there so I don't dominate too much time here, but very thankful for everybody on this panel and the city leadership as well for what they've done to put the city ordinance in place. It was the right thing to do. Thank you.
Thank you, Dr. Lamanteer. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you today?
David, I'm doing well. Thank you. First, I'm going to start with our numbers. Currently in the Amarillo VA, we have 18 hospitalized COVID patients, 8 of which are in our ICU. Now, those numbers seem relatively or very small compared to BSA and Northwest, but understand that's more than 50% of our hospitalized patients have COVID positive. We also are taking care of 7 non-veterans included in those numbers that we are taking. We've taken care of a total of 11 non-veterans since starting. Of those 7, 3 of those are in our ICU. I do also want to remind our veterans that if you are concerned about coming to the hospital for one of your appointments, please call, talk to us about video and telephone options. Remember to get your flu shot. For veterans who want to be tested for COVID, please call our team, talk to someone on our team who can discuss what options are available. The VA is offering it to veterans free of charge. And then many of our teams, those mentioned before me, have just thanked our staff and all what they are doing. One thing I just want to remind, in 1621, the Pilgrims invited Native Americans over for a 3-day feast to celebrate their successful harvest. But let's remember what the reason was of that. The reason is because the Native Americans assisted the Pilgrims with how to cultivate corn, how to extract sap from maple trees, how to avoid poisonous plants. And bottom line is they helped each other out. That is exactly what our RAC team and VA facilities that have sent staff to our VA to assist us with our surge are doing right now. They are assisting us. Now, we're not going to be able to gather and have a big feast with them, but I want to take this opportunity to publicly thank all those who have come to the assistance of the Amarillo, Texas Panhandle community and also our VA right now, and just say thank you for what you've done. As always, I like to thank my fellow veterans for what you've done for our nation and your service to our country. And thank you again for this opportunity to speak to my fellow veterans.
Thank you, Dr. Gonzalez. Now I'll go to City Manager Jared Miller. Jared, how are you today?
Doing good, Dave. Thanks. I want to reiterate that the drive-through testing center is open. Casie went through the hours of operation, days of operation through the holiday period because of the lab closures. Want to remind everyone that if you don't have a means of transportation, if you've been referred to the drive-through testing center for a test and you don't have a means of transportation, we want to make sure you know that Amarillo City Transit is here to be able to transport you to and from that test. If you have been referred for a test and you don't have a means for transportation, call Amarillo City Transit at 378-3095 and they'll arrange free transportation. We have made we've prepared an alternative service delivery plan for all city departments, both internal and external. In other words, departments that service other city departments and departments that service our community. There's been modifications to how we operate at almost every single one of those departments. If you have any questions, if any of the press have any questions about how any one specific department has modified operations and how that will affect the public, I'd be more than happy to answer those questions, but that's going to be something consistent across all departments. The purpose of that is to reduce face-to-face interactions and to provide the safest services that we can possibly do with regard to possible transmission of coronavirus. We have also recently on Monday passed our COVID-19 pandemic emergency measures. Primary purpose, well, and that ordinance is consistent with state statute. It's also consistent with CDC guidance and with DSHS guidance. The primary purpose of that is to ensure that our businesses do everything we can to ensure that they are not places or don't have conditions that are possible and probable mediums of COVID-19 transmission in or between humans. With regard to governor's orders, we are still under Governor's Executive Order GA-29. GA-29 addresses specifically face coverings. And it says every person shall wear a face covering over the nose and mouth when inside a commercial entity or other building or space open to the public, or when in outdoor space, wherever it is not feasible to maintain 6 feet of social distancing from another person not in the same household. There are some exceptions. Those exceptions are found both in GA-29 and also in the city's pandemic control measures ordinance. We also have Governor's Executive Order GA-32. GA-32 primarily deals with all of our businesses and the things that can be open and to what level they can be open. We have 100% occupancy available at essential critical infrastructure locations, at religious services, local government operations, childcare services, public or private schools, drive-in concerts, movies, or similar events, and then also establishments that operate with at least 6 feet of social distancing between workstations like cosmetology salons, hair salons, barbershops, tattoo parlors, things like that. We are an area of high hospitalization, and I think it bears repeating what Dr. Lamanteer said. We are the highest trauma service area with regard to the state's definition of hospitalization rate in the state of Texas. We have surpassed the very high numbers that El Paso had been demonstrating and still demonstrates, and we have now been higher than them for the last couple of days. That's a big deal, and we need to do something together about it. We've talked about ways that we can do that, but with regard to GA-32, we are an area of high hospitalization, and as such, all of our businesses in town that are not essential critical infrastructure, or one of the ones that I mentioned earlier that can be opened at up to 100%, are required to be no higher than 50% occupancy. The only exception is that bars are required to be closed while we are classified as an area of high hospitalization. Dave, that's all I have.
Thank you, Jared. We'll now open it up to questions from our media members. If you have a question for an individual panel member or the panel as a whole, that's perfectly fine. Let's go ahead and David Gay and the Amarillo Globe News. David, how are you this morning?
I'm good. Good morning, everybody. I guess the question that I would like to start with is if with the holiday coming tomorrow, what are hospital and Dr. Lamanteer spoke a little bit about this, but what are hospitals worried about the worst case scenario that could come out of the Thanksgiving holiday and going into more holiday celebrations in December?
Hey, David, I can start there. Just again, reiterating what Dr. Lamanteer said, but if you look at our staff that are out on quarantine, and I personally test a lot of our staff and ask them, well, where do you think you got exposed? You're like, well, my spouse has it, my children. The vast majority of where our staff are being encountering this virus is in the community. It's not in the hospital. So with that in mind, is just knowing what kind of activities accompany Thanksgiving. The concern is that there'll be even more exposure for our staff, in the community, and once again putting us in a vulnerable situation as we have to take care of them, quarantine them, and make sure the rest of the staff are safe. And as the numbers of patients rise, the loss of staff becomes a critical issue.
Yeah, I would share those concerns exactly. Is that the nature of the holiday is that people gather, and if we're doing that, really it's going to increase the risk of unintended and potentially asymptomatic exposure of individuals to those that are infected and potentially transmissible with the virus. And then we have this blow up of infections. We used to talk about people over Thanksgiving holiday in the medical community. We saw a lot of heart failure admissions because of all the sodium load, and all of us, we eat too much and we take in too much sodium, and our folks that have chronic heart failure potential tendencies tend to come into the hospital after these kind of holidays with exacerbations. And what we're worried about here is, and the analogous issue would be the communal nature of Thanksgiving, and then a lot of exposures, and then again, folks being infected and being hospitalization, or even worse than that, our employees being exposed and not being available to care for folks.
Absolutely. And I guess with the institution of the ordinance that was passed on Monday, if the people start to mask up in the community, if people start making that become a habit as they go out in the community, I guess I'll have a similar question. What effect could that have on hospitalization rates with increased mask wearing throughout the community?
David, I would say there's no doubt that would make a huge difference. I mean, you look worldwide, there are entire countries that have very little presence of this virus and very little spread because of just a uniform response of the individuals in that country with these common safety measures. So I have no doubt that this would certainly blunt the spread of this virus and hopefully reduce the number of hospitalizations and stress on the healthcare facilities.
Absolutely. That's all the questions I have. Have a great holiday, you guys, and stay safe.
Thank you, David. Let's now go to David Furtado of KVI Channel 7. David, how are you today?
I'm doing pretty good. How about yourself?
Very good, thank you.
Good. I hope everybody on the panel is doing well as well. And I kind of want to start off. I don't know. I believe it would be Casie that would be the answer to these questions. But do we have a lockdown on the source of the recent increase in COVID? Is it more so because of community spread, or are we seeing any small clusters or anything like that pop up?
So that's a great question. We're seeing lots and lots of community spread. So just like Dr. Weis talked about, family members, workplaces, gatherings, going to lunch with people, just all of the things that we just generally do are risky if we don't wear a mask, or if we don't stay 6 feet apart, if we are doing those things with people outside of our home. And there's potential spread if someone in your home has COVID-19. And so just lots of general spread in the community, which is why it's so important to be mindful of holiday celebrations this Thanksgiving, to really limit that to those people that are in your household, because you don't want to spread COVID-19 to people, to your loved ones, to those family members who are outside of your home. So just really be thoughtful and mindful about how you're celebrating this Thanksgiving.
Alrighty, thank you, Casie. And do you know of this off the top of the dome, or do you have this noted, annotated, or somewhere? But are the positives that we're seeing from the drive-through testing facilities through a lot of these testing, are these mostly symptomatic patients, or are we also seeing some asymptomatic patients? Is it a mixture of both?
So through the drive-through test site, you do have to be symptomatic, but the requirement is very low. So we just require at least one symptom. And so, like Mayor Nelson said, it could be, very, very minor symptoms. And so we do ask that you have a symptom, but you don't have to be very symptomatic to be tested at the drive-through.
Okay. And a couple more questions for you. Do we have a breakdown of the deaths within each of the age groups? And do we know how many of those may have had any comorbidities with that and whatnot?
So we do have those deaths broken down by age group, and you can find that information on AmarilloAlerts.com on the dashboard. We don't have the information broken down by other chronic diseases or other high-risk conditions. I can let the doctors speak to that. They have that information more firsthand, but we do know that there are that those chronic conditions do put people at risk to having other complications related to COVID, but we're certainly all vulnerable to being exposed and to getting COVID-19. So masking is so important. Again, staying 6 feet away from others, or at least, staying far away from others is so important, and to, good hand washing.
Okay. Now, my last question is mainly for the hospitals. I know Dr. Weis mentioned, put up a stat talking about how we saw 53 deaths since November 1st, and only 20 over in October, throughout October. So we can really see the exponential growth that this virus is having. Now, there has been a tally of at least 1,000 hospitals across the country that are at critical staffing levels. So my question to the hospitals are you guys at that critical staffing? I know you have other nurses coming in, but would you say you're at that critical staffing mark? And how much longer could we see this exponential growth go on for before you guys can no longer effectively treat the health of Amarillo?
I can start there. And the short answer to your question is yes, we are at that point where we are at our maximal staffing capacity. Clearly the RAC has been a substantial benefit to our region in terms of supplying a large number of healthcare workers, nurses, respiratory therapists, and now even physicians. The bulk of that support being nursing staff, which requires a highly trained nurse to be able to help us manage these patients. And for us to assume that our region is going to continue to be the region that is going to be so maximally supported, and as if no other areas in Texas will need this support, I think would be a foolish assumption. So there's going to be a point at which those resources are going to have to be rationed to other parts of our state so that we can help all parts of the state that may be getting a delayed surge compared to what we're experiencing. So we're at that point, no question about it. We can't handle another 30 days with a similar rate of rise of admissions. We simply can't do it. There's no way we'll be able to manage those patients in our hospitals. And the main reason for that is because of the intensive care services and intensive care staffing, physicians and nurses that would be needed to manage those patients.
Yeah, and I would totally agree with everything Dr. Lamanteer said. One thing, we, just like BSA, we are completely dependent on these RAC-associated nurses to staff our hospital. And part of the challenge is this is a fairly fluid population of staff, both doctors and nurses. So on any given day, we may come in and find out that maybe 5 or 8 of these nurses didn't report in the morning because they demobilized. And then maybe the next day we have 10 show up. So, new ones. So problem is any given day we can go from understaffed significantly to almost overstaffed when we suddenly get a new infusion or influx of these nurses. So that's been a challenge, is just trying to manage this population of people. That's been a huge help to us. But at the same time, I agree, Dr. Lamanteer, but what I see is, particularly among a lot of our nurses and our doctors, is yes, they may be doing it okay today, but they're getting tired. They've been doing this for months and months, and that most of them have not had days off. So you're not only dealing with the physical number, but you're dealing with the fact that they're fatigued. And that's my big concern. And then if they start getting sick because of that vulnerability. So yeah, we are at the point where we can't take much more of this, and any significant increase is going to break the system.
Gotcha. I know I'm kind of short on time here, so I just want to leave by saying I hope you guys have a wonderful Thanksgiving, have a happy holiday, and Mayor Nelson, I hope you and your family feel better.
Thank you, David. Hey, by the way, just a related question. If you go to AmarilloAlerts.com, all the demographic breakdown is on there as far as the COVID cases, age group by counties, confirmed cases by counties, things like that. I just thought I'd throw that out there real quick. David, thank you, though.
Thank you.
Let's now go to Aaron Langston of KAMR Channel 4. Aaron, how are you today?
Pretty good. First off, Mayor, hope you get to feeling better soon and have a speedy recovery. First question, Dr. Weis talked about the number of deaths they had since the first of the month. Dr. Lamanteer, do you have that number off the top of your head?
I don't have the exact number. It's a little higher than I last saw compared to where Northwest is, but that's because I'm certain our absolute numbers of COVID cases have been higher than over at Northwest over the past several weeks or more. The percentage of deaths we're seeing per month are absolutely similar in terms of the total, but we have more than doubled the number of deaths in the month of November compared to October.
Alrighty. What kind of, prolonged symptoms are we seeing from people that have had COVID and have seemed to getting over it, but still show side effects and symptoms afterwards?
I think many individuals can have a prolonged fatigue, headache, and weakness. There's an entity called brain fog, where people just don't seem to have a sharp of a memory and cognitive function that can last for weeks. So there certainly are several different things and several different symptoms that can be very prolonged.
I would say I've had a couple associates who had COVID, weeks ago, and they struggled to even hold a conversation with me walking down the hallway. So this prolonged shortness of breath also is another symptom we're seeing.
I would agree with all that. The prolonged sense of shortness of breath that folks are having, some are having weeks of loss of sense of taste and smell that has not come back for weeks, and some that we've not permitted some of our healthcare workers to come back to work because of them just being too short of breath despite being weeks out from their infection.
All righty. And you talked about patients returning after being discharged. How many cases of that have you guys seen, and how big of a concern is that for you?
Good question. I don't have exact numbers. I know anecdotally from our hospitalists that are managing these patients and our Texas Tech physicians, they're reporting folks that have either sought health care at an urgent care center were confirmed positive, maybe even had some x-ray findings that were suggestive of early COVID pneumonia, but were being managed as an outpatient, and they show up in our facility, or folks that we've been taking care of or saw in our ER that we sent home appropriately because they were early in the course of their disease, but only to present back a week or two later. And there, unfortunately, some of those individuals, a percentage of those, that go on to a more fulminant inflammatory cascade and then come in with a more fulminant pneumonia, shortness of breath, low oxygen levels, And as I mentioned, some of those patients are undergoing clotting complications, which can be quite severe and concerning.
Yeah, I mean, I would say kind of interesting. One thing we try to avoid in the hospital is if someone's in critical care, by the time we make the decision to take them out to a normal med surg floor, so to reduce their level of care, we really hope that they're going to do all right. With this virus, we have seen more patients go from ICU to med surg, and then within 48 hours, they can become critically ill again and go right back to the ICU. And that's been a recurrent theme, unfortunately, with this virus. And again, much of what Dr. Lamanteer said, which is they hit this cytokine storm, and they go from kind of being okay and to all of a sudden becoming extremely ill very acutely. So we've seen a lot of that bouncing back and forth between critical care and the floor.
All righty, thank you. And Dr. Gonzalez, you said that y'all have been taking on patients from BSA and Northwest when possible. How much are y'all able to take on as far as non-veteran patients right now?
So as I mentioned, currently we have 7 non-veterans in our facility. We've had a total of 11 since we opened up to non-veterans. Most of ours are actually from other community panhandle facilities. I know BSA talked to us yesterday about a few, and so we are open to whatever. But I'm going to be honest, is sometimes we transfer patients to BSA and Northwest too. So if they exceed our capability, and so when we have somebody within our capability, whether it's at BSA, Northwest, or many of the other community hospitals in the Panhandle, we're ready to assist. Currently, we still have a couple ICU beds and a few med surg beds if needed, and I know the teams are eagerly talking to see what we can receive. But we do have to make sure it's within our capability, not just that we have a bed.
All righty, I think that has me covered. Thank you all very much.
Thank you, Aaron. That was all the questions we had from media today. This concludes our news conference for this week. Once again, this is David Henry. I'm the communications manager for the City of Amarillo. I want to thank all of our panelists for taking the time out to participate today and provide this information to the community. Thank you for your time. And we'll see everybody next